patient with a slow pulse was advised by a doctor to drink Coca-Cola to bring it up. A patient bleeding from the anus for 18 months was receiving blood transfusions with no tests until an endoscopy much later revealed that the patient had cancer. By then, it was too late. A patient was told she had diabetes and was receiving treatment as a diabetic for 12 years only to find out she was never diabetic. A doctor without any formal surgical training was alleged to have performed a complicated bowel surgery on a patient who died in the operation. A patient bled to death after a doctor carried out a renal biopsy without a simple medication history that would have revealed the patient was on aspirin, a blood-thinning agent. A doctor administered a dextrose drip on an unconscious patient without first checking if the patient was diabetic. The patient never woke up. Another diagnosed bone tuberculosis by just touching a patient's jaw without doing a single investigation and had planned to remove the patient's jaw. The patient was saved when she sought a second opinion while abroad and was found to have a benign lymph node. Nigeria is the largest country by population and also by many metrics the richest country in Africa, yet Nigeria has some of the lowest life expectancies in the entire world and some of the lowest in the continent. While countries like Botswana and Ghana have life expectancies of about 70 years and 65 years respectively, Nigeria is a place where people are only expected to live to about 55 years old. This makes it the fourth lowest in the entire world as of 2021. Even though life expectancy numbers can result from many different factors like crime or even diet, a major determining factor is healthcare, and sadly it shows in Nigeria. Hi, my name is Chike and welcome to my channel. In this video, the question I hope to answer is why Nigeria's healthcare system is failing and how that shows throughout the country and internationally. I was motivated to do this video because of an article I read. I'll link it down in the description box below. But basically, it really surprised me because I didn't think anything of that nature happened in health institutions in anywhere around the world. So, interested by this and a few other articles, I decided to do a ton of research on the Nigerian healthcare system and its status within Nigeria and worldwide, and it really interested me. I hope you enjoy this video and learn something new, or learn something that you didn't really think about or realize before. Without further ado, let's get started. First and foremost, I thought it would be important to first identify what exactly is healthcare. Healthcare can be defined as a system of medical professionals who act in accordance with treatment and prevention of diseases, illnesses, and physical and mental harm and damage. It has essentially been present since really the first city-states and villages of humanity. Some systems are simple and local, while others are complex and widespread. When we first think of healthcare, we think of doctors, nurses, medicine, hospitals, etc. And when we're in need of help, these are some of the first resources and people we use in contact. Healthcare may relate to the overall health of an individual, but it also relates to the overall health of a family, village, city, state, and nation, and small changes are seen whenever you go to a different community or country. Before European encroachment, the history of Nigeria's healthcare system resembled other indigenous populations in the way that it was exclusively focused on traditional medical practices. Qualified and experienced professionals used their knowledge of plant life and animal life to help heal diseases and treat the population. This system was based on the standard of the knowledge of the professional, which included environmental, biological, and physiological understanding, and it also created a well-outlined apprenticeship system that allowed them to act as healthcare practitioners. This apprenticeship system required years of instruction and not only herbalistic science, but also therapeutic and sociological knowledge to bring about the best solution to communities. The purpose of being a traditional medical provider meant more than treating people. It meant being an active agent of pre-colonial societies by healing and bringing together entire communities culturally. They were a cornerstone of civilization and were very well appreciated. When Europeans first entered modern-day Nigeria, they naturally brought Western medicine, and with it, they introduced new healthcare services you could take advantage of, but it did come with a price. I do want to note that Europeans did not introduce the concept of paid medical services in Nigeria, as traditional medical services did include a fee. It was usually in the form of bartering and was typically more out of goodwill and general mutual understanding. It did not define the essence of traditional medical practices because no clear fees, costs, or prices existed. Most of the Western medical attention was focused on the urban cities rather than the rural areas, but it was really the Western missionaries that changed everything for rural communities after an influx of Western doctors and medicine arrived in the area in the name of evangelism. It forever altered the significance of traditional medical practices because the religious missionaries converted them, and with the conversions came a belief that traditional medical practices were evil, wrong, subpar, and associated with witchcraft. When the 1960s, also known as the Decade of Africa, arrived, Westernization in the form of medical practices was deeply ingrained in urban cities, and Western medicine was now the preferred healthcare service in rural villages. This ultimately created the foundation the Nigerian government developed upon post-independence. During the first few years of Nigeria's birth, the government believed a Western-style healthcare delivery service was the best method for Nigeria, so to further develop this method, they sponsored scholarship opportunities for young Nigerians to study outside the country, abroad, in places such as the United Kingdom and France, in which they studied medical practices, nursing, and other related skills. Simultaneously, orthopedic, general, primary, specialist, and other types of hospitals and medical centers were being constructed in principal parts of the country like Lagos and Kano. They did this because they wanted to grow hospitals as much as possible by increasing the number of medical technology and the overall healthcare workforce. When newly educated students returned, they were situated in high-ranking positions in the medical industry, and the government placed a ton of influence on local citizens to respect and value the new public hospitals they were creating and the new medication they had imported because they were free or at the very least heavily subsidized. This new healthcare was at its core a welfare-based system. This system, founded by Britain and built upon by the Nigerian government, worked for a very short time, but quickly fell once oil prices started to plummet and corruption became a commonplace occurrence amongst government officials and key figures. All of the new pharmaceuticals Nigerians took advantage of soon experienced a shortage along with equipment and medical centers. Even the salaries that medical professionals depended on to support themselves, their families, and their communities became unreliable. Not to mention, people who lived in rural communities were seemingly forgotten overnight and were left with virtually no medical framework. As a result of the long, advantageous relationship between Nigerians and a colonial-derived healthcare framework, the knowledge of traditional medical healthcare was essentially dead because it was not passed down to the youth. It probably wouldn't even have mattered to them at the time because traditional medical practices was still seen as bad and something someone from the bush would use, which is still commonplace consensus to this day. With Nigerians left confused, private healthcare started to become more popular. The health disparity grew larger, and the need to address Nigeria's health sector issues, along with all of these other factors, led to fraudulent doctors and fake medicine toward the 80s. During the 1980s, the economy started to fall, so the government, in response, had structural adjustment programs introduced, which caused way more harm than good. Structural adjustment programs were basically loans given to struggling countries by the World Bank, the International Monetary Fund, and some regional banks to help stabilize their economy. This, in hindsight, did way more good than bad. Anyways, it ultimately led to lost faith in the public and even made accessing private healthcare much harder. Cheap, poor quality drugs found a way to Nigeria, so even if you could somehow access quality healthcare, the medicine you receive wouldn't even be quality. It even got to the point where untrained everyday people started to set up their own chemical shops and medical centers out of greed and desperation that in the end didn't do much. The people wanted a radical change, so by the end of the 1990s, the government finally listened and attempted to tackle the problem by enacting the National Health Insurance Scheme, or the NHIS. Since its creation, it has not done much in helping Nigerians as only 10% of the population are under it, and those who are under it consist primarily of government officials and private employees. The main issue back then and today is a lack of understanding of the diverse frameworks Nigeria has and a lack of teamwork between all of Nigeria's healthcare sectors. Today, behind Capo Verde, Nigeria has the second highest population density of doctors within West Africa, but even though that may sound like a good thing, the needs of over 220 million people as of 2022 are not being adequately addressed. There are about 4 doctors for every 10,000 people, so obviously resources are being stretched very thin, and the life of a doctor is naturally strenuous and overwhelming. To put this in contrast, an ideal goal would be about 1 doctor for every 1,000 people, so obviously the goal is severely not being met. About a quarter of the population is not able to easily access vaccines, and vaccine hesitancy among everyday people is actually one of the worst in the world. In 2019, the top 10 main causes of death were all health related and can be curbed with easy and quality access to healthcare resources within local communities. Many mothers don't get to see the life of their child, as post-pregnancy maternal mortality in Nigeria is one of the highest in the world. It accounts for 10% of all global deaths, even though 3% of the world population is Nigerian. Nigeria also leads number 1 in the world with highest rates of child death under 5 years old, even surpassing countries with over a billion people like India and China. These are just some of the grim realities Nigerians face on a day-to-day basis. But why is Nigeria's healthcare sector facing these problems? Though the situation seems very complicated, and in reality it is, there are a few reasons as to why Nigeria's healthcare system is failing, and the first one is a lack of investments. Out of Nigeria's entire GDP, the government only spends about less than 4% of it towards healthcare. That amounts to about 11 million US dollars, which is not anything and is barely enough to support the entire Nigerian population. Since government spending is so low, 72% of Nigeria's entire healthcare expenditure is paid out of pocket. Most of the population is not covered by health insurance, so when people visit hospitals and medical centers seeking treatment, the costs of it are also paid out of pocket. There are even some stories of people essentially not being able to leave certain hospitals without settling payments. And for very serious medical treatment, an over ₦500,000 deposit is required before healthcare workers even begin working on a patient, which is not a reality for most Nigerians, as almost half of the entire population is living within extreme poverty. But I just want to note, it's not really the hospital's fault. The reality is a lot of health centers would end up closing if they don't charge so much and receive full price of their services because government funding is so low. Many Nigerians complain about the lack of empathy healthcare workers have and how disrespectful they can be, but keep in mind that health centers need money for general operation and equipment, not to mention to pay for the paychecks of these healthcare workers. So, on the surface level, even though healthcare workers may seem devoid of caring and emotion when taking care of you, the reality is they're honestly just overworked by the same system Nigerians go to for help. In the grand scheme of things, no one is being treated fairly in the system. Another effect of a lack of investment in the healthcare system is a lack of medical amenities, devices, medication, and even public health services that people take for granted. Nigeria does not have a public ambulance system like 911 or 999, so if someone were to have a heart attack right now, they're more than likely to die right then and there. This is often a reason why people don't value the national health system, to the point where there's a saying that hospitals are a place where people essentially go to die. Medical centers packed with sick people, coupled with expensive visits, causes people to lose faith in a system that simply does not benefit them. As a result, Nigerians who can afford to often jet away to countries like France, the UK, the US, India, Australia, and others to seek quality healthcare. Another reason why Nigeria's healthcare system is failing is due to brain drain. If you're not familiar with brain drain is basically a phenomenon in which highly skilled individuals leave their home country for another country. This can happen for many different reasons, but in Nigeria's case, it happens because the country is not paying them nearly enough for their skills. In their minds, it makes sense. For example, why work in country A making 50,000 US dollars per year when you could work the exact same job in country B and make 150,000 US dollars per year? In 2020, the highest monthly paycheck of a Nigerian doctor was 1,365 US dollars. This is not a lot, and working the exact same career, a doctor could make almost 10 times as much as that working in the Middle East or in the West. Of the 56 countries they identified, 64% were African. In 2017, the World Health Organization identified a list of countries that have a lack of healthcare workers. 4,528 Nigerian doctors left the country to work in the UK between 2015 and 2021. In a poll conducted in 2018, 88% of Nigerians said they plan on leaving the country to work abroad. According to the Nigerian Medical Association, as of this time, 2,000 Nigerian doctors leave yearly. Not to mention, the United Nations Commission for Trade and Development estimates that each African professional lost to countries represents a loss of 184,000 US dollars to Africa. In the long term, Nigeria ends up losing money. It costs tens of millions of dollars just to train these doctors, just for them to leave in a few years. It's even to the point where Nigerian doctors account for most black doctors in the United States, accounting for 77% of all black doctors. A major reason for brain drain in Nigeria are the push and pull factors. Push and pull factors help us understand brain drain, in which the push factors represents what exactly is pushing someone to leave, while the pull factors represents what exactly is attracting someone to that country. In Nigeria's case, the push factors are often cited as poor working conditions, low growth mobility, and low inconsistent pay, while the pull factors are often cited as better working conditions, consistent pay, and more opportunity to grow professionally. Just recently, the president of the Medical and Dental Associates of Nigeria went public stating that one of the reasons Nigerian doctors are leaving Nigeria is due to the government, which appears to target medical professionals and their practices. He could be referencing the payment Nigerian doctors receive inconsistently, which causes many doctors to go on strike or protest in which they refuse to work until their demands are met. The health industry is not the only industry to experience this. Professors in schools and colleges often go on strike for the same exact reason, but instead of doctors, students now flock to Western countries to receive an adequate education because striking can often cause them to graduate late. All of these doctors leaving has created a gap between patients and the medical system, which has only been growing bigger and bigger every single day. Many healthcare workers are still waiting for payment they should have received years ago, along with their COVID allowances. The result are Nigerians who can't access quality healthcare, who may suffer misdiagnoses, and have to wait very long periods of time to even see a doctor. To help remove some of the governmental burden and personal burdens in paying a healthcare system that honestly is not working, Nigerians abroad need to invest in the healthcare sector and medical centers so we can see better equipment and shorter wait times. But in order for this to happen, Nigerian working conditions simply need to improve. The effects of brain drain are not being documented enough, so at this point, we just don't really know the true scale of brain drain and the effects it's having on the Nigerian government, society, and economy. On the contrary, brain drain may have some perceived positive effects too. In 2018, Nigerians living and working abroad managed to send 24.1 billion naira back home to Nigerians living in Nigeria. This ended up tripling Nigeria's capital expenditure. The effects of brain drain are literally to the point where the amount of money emigrating Nigerians sent back to the country is more than the oil production and exportation that year, which was 18.2 billion naira. Last year, Saudi Arabia held an event to recruit Nigerian doctors in which hundreds of Nigerian doctors attended. And it seems like the Nigerian government will not invest in the healthcare sector anytime soon because government officials like the president are constantly leaving the country to take advantage of the healthcare sectors of developed countries. Even the Minister of Labor and Employment outwardly said that Nigeria has a ton of doctors, and those who decide to leave the country in search of a better life are in their own rights and not an overall concern to the country. This implies a lack of data collection and a lack of accountability, as it is well known that Nigeria has some of the lowest doctor-patient ratios in the entire world, among other dismal realities. Among other reasons for Nigeria's poor healthcare systems is due to, well, poor healthcare frameworks, along with the lack of coordination with all of Nigeria's different types of healthcare systems, which include public healthcare, private healthcare, and traditional healthcare. We have vaccine hesitancy caused by the West exploiting local people, unequal resource distribution, healthcare corruption, and poor data collection, which doesn't even paint a full picture of the problem Nigeria faces. All in all, there are many things the Nigerian government can do, but I believe everything starts with the people. Nigerians need to start holding people accountable, and those who left the country need to invest in the frameworks they left behind. And on that note, thank you for watching. I hope you enjoyed the video and learned something new. If you have any comments, anything that you want to mention down below, leave that in the comment section. Anything that you learned, anything that you experienced in the healthcare system in Nigeria, anything that I possibly missed, feel free to comment that and I'll take a look. Overall, I'm really happy that I was able to do all the research for this video, as a ton of research went into this, and I just really hope you enjoyed it and learned something new. Thank you for watching, and I'll see you guys next time.